After the murder of his parents in 2008, Stephen Kigoma was abducted from his home in Beni, Democratic Republic of Congo, and taken to a military camp where he was repeatedly raped before escaping to Uganda just over a week later.
When they finished, they left me at other place. Now they opened me. But I have no power to walk. I couldn't even stand at that time. I was just asking myself, I wish even if they had just killed me more than doing that to me.
Eastern Congo has been plagued by instability since the early 1990s, and various militia groups continue to wreak havoc on the population. Rape of women and men is used as a weapon of war here to humiliate and demoralize communities into submission. Just under 24% of men from Eastern DRC have been exposed to sexual violence, compared to around 40% of women, according to a 2010 study in the Journal of the American Medical Association. Dr. David Ndaula has treated over 300 survivors of gender-based violence at his Kampala clinic. And though male rape cases are a fraction of those against women, he says that men, worried about being seen as weak or being labeled gay in a deeply homophobic society, are less likely to seek help.
Number one, the poor understanding of the problem is a big one. A legal framework that is not so friendly to people who may be called gay is another thing.
According to Chris Dolan, the director of Uganda's Refugee Law Project, there is a need to include men in sexual violence definitions and programs at a policy level. Some progress has already been made.
There has been growing recognition that the issue of men and boy victims has to also be considered, and that came out twice this year. In April, the G8 foreign ministers issued a declaration saying that there has to be a comprehensive response to women and girls, men and boys.
While society is slowly becoming aware of male rape, the services and support for victims remains far from gender neutral. And for the survivors, the pain of their experience cuts just as deeply, no matter their gender.